Excellence in Science, Shimadzu.
Well, good afternoon, ladies and gentlemen. It's my honor to welcome you all to this joint webinar from Spinco and Shimadzu. Today's topic of the webinar is Shimadzu's UFMS solutions for forensic and toxicology applications. LCMS has been one of the defining techniques for various applications. Ultra-fast mass spectrometry, popularly called as UFMS, provides Shimadzu's unique advantage to achieve a new global standards in mass spectrometry. So this webinar is brought for various applications. So this webinar is brought to you by Spinco Biotech, India's leading analytical instrumentation company, which started in 1981. True to its tagline, Spinco is bringing technology and enabling science for the past 41 years. Customization has been the cornerstone of our company culture, which simply means delighting our customers at every touch point. So our principal Shimadzu was founded in Kyoto in the year 1875. Shimadzu's corporation has been supplying cutting-edge products to customers throughout the world for over 145 years. Shimadzu has always been committed to its corporate philosophy, contributing to society through science and technology. So back to the topic in hand today, it gives me immense pleasure to welcome Mr. Bhaumik Trivedi to this webinar. He is currently the Assistant Manager, Clinical Diagnostics in Shimadzu Analytical India Private Limited, Mumbai. He has over 10 years of industrial experience in clinical testing, method development on analytical instruments like HPLC and LCMS. He has a master's degree in clinical biochemistry and a diploma in forensic sciences from Mumbai. His expertise is in bringing innovations to method development and applying them in clinical and forensic testing. So with this brief introduction, I hand it over to Bhaumik. So before that, I have some housekeeping rules. Please type in your questions only in the Q&A and not in the chat box so that we can answer your queries at the end of this session. So over to you, Bhaumik.
Thank you very much, sir, and thank you for your very generous introduction about my. So won't spend much time. I will quickly share my screen and will directly start with the topic. Just a confirmation, is my screen visible?
Yes, it's visible.
Perfect. So today we are gathered here to basically understand that how the technology, which is improving day by day, can help us in reaching to our endpoint and our destination of giving authentic results which are highly reliable and give us an excellent confidence to whatever work which you are doing in any forensic lab or any toxicology lab. So won't spend much time and will directly start with forensic science solutions by Shimadzu using our ultra-fast mass spec systems which are available in the industry, which are really very excellent to work with. So start with, we need to understand that what can be the challenges and demands. So before I get into the topic, I will request Satish to put up a poll and let us try to understand like what our customers feel when it comes to toxicology testing, and we can understand that the approach which we are taking or the drive which we are taking ahead is in line with what our expectations from customers or the customers' expectations are from the vendors. So over to you, Satish sir.
Yeah, so I'm just having a poll question here. So the question is, what is the main hurdle in the toxicology lab? So you have the options of operation of analytical systems, sample preparation, or data interpretation. So you can choose any of these three so that Bhomik will have a clear idea like what needs to be explained. So a lot of answers are coming in. Yeah. So we'll just wait for another probably 10 seconds. Okay, 5 more seconds. 5, 4, 3, 2, 1. Okay, I'll end the poll now. So yeah, so the results are operation of analytical systems 19%, and sample preparation I feel is the number one cause. 56% say sample preparation is the main hurdle in toxicology lab, and data interpretation around 25%. So over to you.
Yeah, excellent. So let's see, like we are almost in line with what the concerns are and what hurdles are. So we'll start with the challenges first, which we understand can be in the forensic industry. Like the current challenges basically are the operator skills, obviously, because the analytical instrument are a little bit different to handle. They are not like a very traditional technique which you might be using. But in MS, especially when it comes, it has a demand for a good operator skill, or probably whatever is available, it may need some skill to work upon. Then the biggest challenge is that you need to have authentic standards. That is one of the biggest hurdle which I can see, because when it comes to toxic substance analysis or any kind of molecule analysis, wherein you don't know what it can be, because the samples which we may receive in lab can be absolutely unknown to us. So to do any kind of screening or any kind of identification, before you come to a particular conclusion, you need to work with some authentic standards to set a method or to start with something. So the authentic standards are another challenge which we are looking at. And obviously, as you all mentioned, the sample preparation is also one of the biggest challenge which all of us are facing in the industry. At the same time, the demands are that you need an analytical system which may need near to no or very less expertise. At the same time, there is a good enough demand for semi-quantitative methods wherein you don't have to use any kind of don't have to use any kind of authentic standards. At the same time, we need to have an optimized sample preparation technique which is ready to use, which may help in reducing a lot of work in the lab itself. Moving on, we'll touch base a bit with what the traditional MRMs are. When we are talking about LCMS, then obviously we are talking about MRM analysis by itself. So when we are talking about MRM analysis or the LCMS analysis, we need to see what are the traditional MRMs are and how they are helpful in the quantitation. So if we see in this, the typical chromatogram which is generated when we are doing LCMS analysis will have a quantifying ion, then one or two additional reference ions, basically to identify the peak with correct intensity ratio. At the same time, you need to have the correct retention time again and again, so that you can understand whether the identification which you are doing is appropriate or not. Hence, MRM for screening is most accepted method due to its specificity and sensitivity. Authentic standards are required for optimization and quantitation, because to generate these MRM transitions, You need to work with the authentic standards so that you can have an excellent method which can be developed. But at the same time, we can understand that procuring many standards will add a lot of cost. At the same time, it will add a lot of work as well. And at the same time, we can understand a full scan data is still required when we are doing screening. So these are the most fundamental things which we can understand when we are working with the traditional approach of MR. Now, as we were able to understand, and we studied and we interacted with a lot of customers, and we were able to understand that basically the customers have three fundamental wish. That is, first is screening without authentic standards. Highest confidence in identification is needed, and at the same time, they need to have a good high-speed LTMS system. So these are the main three wishes which we were able to understand when we had interacted with multiple customers across India. So to address that, we have, like Shimadzu has, a rapid toxicology screening system. Now, it is a complete method package which is being provided, which is capable of doing semi-quantitative result analysis without the use of any authentic standards. So this is the most unique concept which we are going to provide to you, wherein you can do semi-quantitative result generation. You can come to know about the tentative concentration of any particular substance which you are targeting without utilization of any authentic standards. At the same time, the calibration curves are already being incorporated in this particular method set. Hence, there is no method optimization which is required. At the same time, there is no need to plot any calibration curve to extrapolate your concentration in the unknown samples which you are working upon. This screening system has 231 compounds, which includes common drugs of abuse, the hypnotics, psychotropics, pharmaceutical, and other natural toxins. And above all, Shimadzu's triggered product ion scan, which provides MSMS data during MRM acquisition itself, is one of the most unique feature which is available in this particular method package, and which will help you in getting the maximum confidence on your data which is being generated. So this particular screening system, that is rapid toxicology screening system, will include something that is sample preparation. Then the measurement is done with the help of the method of sample analysis. Then it comes the peak detection, which is one of the most important factor, and identification and the semi-quantitation of the results which will be generated, which will be helpful for you in getting the appropriate concentration of the particular molecule which you are targeting for. Hence, this particular package, as I mentioned, it has the compound panels of 231 compounds plus two internal standards. It has the runtime of 15 minutes. It has internal standards for both positive as well as for negative ions. Above all, it provides you a ready-to-use LC and MS method for each compound. Hence, it saves a lot of time for you. At the same time, if we can understand, you don't have to invest even a bit to do any kind of development. It's a plug and play a solution which will be provided, and it can be easily being utilized. It also includes the most fantastic part, that is, it includes the spectral library for the registered compound with the report files. So there are certain report formats which will be again part of it. So for an end-to-end solution, this kind of rapid toxicology screening systems are excellent when it comes to any forensic lab if you are working in. Hence, it gives you shorter runtime, large compound panels, and better quantitative performance will be provided with the help of this particular solution available with Shimadzu. Now, as we all know, that sample preparation becomes the hurdle, and as even the audience is of the same opinion. So in this particular method package, the sample preparation, which has been completely optimized for forensic application based on pressures, is part of this particular method. So you don't have to spend time in optimizing the sample preparation protocol. or to do any kind of the research and development or any kind of trial and errors for the sample extraction, you will receive the complete protocol of quechas. And to give you a brief idea, this is how your protocol will be. That is, you'll be using in the sample, you will be adding water with acetonitrile, which will be having two internal standards. To that, you will be adding the extraction salts. Then it will be followed by shaking, and there will be centrifugation, which will be done. We'll be getting the supernatant, and this supernatant will have to add the TFA. You have to dry that particular supernatant with TFA, which you will get. And then again, we need to reconstitute it with the methanol. And that reconstituted solution should be injected on the LCMS for the analysis. So this is a simple workflow which we have optimized. So if you have this particular method package, then you'll be getting the details of it, wherein the exact concentration of the solute or the volume of each and every chemical or the salt will be mentioned to you, which will help you in doing the sample extraction flawlessly. With the help of this particular method package, where the sample preparation is already optimized, the method which is available, that is for the LC and the MS method, which we have, are being completely optimized. At the same time, as I mentioned to you, we have the calibration curves, which are already incorporated in the method package, and you don't need any kind of authentic standards to generate the MRM transitions. So with the help of all these solutions, we were able to generate some data, and here is a representative data which you can see, wherein we have been able to get the semi-quantitative results. And here you can see for even the low concentration, we have generated the percent RSD, and it falls much within the limits. And we were getting very good reproducible results. So just imagine a lab wherein you don't need any standards and you can do the quantitation. This is the excellent part which we are giving it to you. So even at lower concentration level, you can have an excellent percent RSD. And to show the representation of the chromatograms which are being generated for the hypnotics and psychotropics in the human whole blood samples which are being analyzed, even at 0.01 nanogram per ml, you can see the peak and the intensity. At the same time, we have mentioned the signal to noise ratio as well, which is excellent, and you can 100% rely on the data which is getting generated. So this was with respect to the semi-quantitative approach and how you will be able to do quantitation even without utilization of any standards. Now, before this step, before you understand that you have to quantify or you have to report the concentration, or you have to finally give the final report of a particular drug which you have been identified in the human matrix, how you will be able to confirm or how you will be able to understand that it is the exact toxic substance which you are reporting is correct or not? How authentic is the substance which you're going to report? So how you'll get that particular confidence? So to address that, Shimadzu has a very unique approach or a very unique solution, which is again part of this particular method package, which we call it as MRM triggered product ion scan. Now, what it basically does is you'll be scanning your particular sample in this method package, which has transitions and the MRM transitions for 231 compounds. And you'll be able to identify with the help of scanning, and compounds will be identified and which can be reported. But if you want to confirm further, with the help of the feature, which we call it as MRM triggered product ion scan, when the signal hits a particular threshold in the LCMS acquisition scanning data, it will get analyzed at different collision energies. Now, what will happen is at different collision energies, which you can see here on the left hand side of the screen, that is at a particular threshold when it is being hit as the intensity, it will undergo the collision at different level, that is at 10V, 35 voltage, and 55 voltage. Hence, it will generate three different spectra. Now, this three different spectra will be automatically acquired and it will get merged and it will act as a single spectra. Hence, three spectra will be clubbed together to form a single spectra of product ions. So this particular merged spectra, which is acquired, the acquired spectrum data are automatically merged and searched as the product ion spectrum. Further, this product ion spectra which is generated can be correlated with the library which is being provided as the part of this particular method. In this system, it will able to give you the similarity index score for the particular molecule which you have targeted upon, and it will give you the confidence on the data which is being generated, and that can be reported further. Not only that, it will don't only give you the similarity index. At the same time, it will be able to provide you the structure as well. So if you try to see here, it gives you the peak, it will give you the comparison of the spectra. At the same time, it also shows you the structure of the molecule which is being identified and being screened. So it will give you a very high level of confidence when you are working on a absolutely unknown substance given to you. And with the help of this particular method package, that is rapid toxicology screening system, will be able to identify the particular molecule which is of your interest. Hence, with this, we will be able to fulfill the first wish of the customer, that is screening without authentic standard. And with the help of rapid toxicology screening system using LCMS, you will be able to screen 231 compounds. Now, the next wish is that you need to have highest confidence in the identification as well. Now, that can be fulfilled with the help of the forensic toxicology database, which is available with Shimadzu. Now, this particular database is a very simplified acquisition and identification solution, which is provided by Shimadzu. It contains MRM transitions for 2,500 plus compounds, and spectral library database for more than 8,000 compounds are available in this particular database. Enhanced identification by merge spectrum is again one of the solution which is part of this particular method package, which will be able to give you very high confidence with unknown identifications as well. Now, if we move further, I'll explain you more about this particular toxicology database. Now, as I mentioned that we have the database for 2,500 plus molecules. And in that, we have divided this particular category of molecules into two, depending upon its chemistry and to avoid the interference of matrix to get the best result out of it. So it has been defined completely on the nature of the molecule, and we have segregated on the basis of the separation which has been done on the column. So on that basis, we have a method set for ODS column. So we call it as ODS method. And we have the certain molecules which we have segregated on biphenyl column. So we call it as biphenyl method. There are certain 372 molecules which are overlapping, which can identified on both ODS as well as on biphenyl. Hence, depending upon a tentative idea of what can be the group of molecule which you want to target or the toxic substance you want to target, you can select a particular method set which is ready to use, or in case there is absolutely no information available with you, then you can directly opt for both the kind of methods by changing the column. Just by changing the column, the method is ready to use. So you'll have to only switch column, which hardly takes any time, approximately 5 minutes, and you'll be able to do this particular screening by itself for on the both the methods. And you'll be able to screen approximately 2,500 plus molecules in matter of time. Now, this particular database is highly customizable as well. So for example, if you want to make the panels, which will be a one-time activity, you want to categorize your group of compounds depending upon certain type of toxic substances. So you can do that paneling as well. So here is just a brief example which we have been generated. For example, there are 10 internal standards which you want to keep. So you can keep those 10 internal standards as a group of a compound. And then you want to keep a group of cocaine and amphetamine and opioid as and you want to select 35 compound as group of it. So you can make a panel for this CAO and you can keep it as an individual method. You want to keep an individual method for the anti-epileptics or antipsychotics or barbiturates. You can select the specific compounds and you can have another method for that separately again. Or you want to have a method for benzodiazepine for specific 36 compounds, you can keep that as well. Or you want to only keep it restricted to cannabinoids, you can select 5 cannabinoids which are of your interest, and you can always screen and try to get the result. So this is completely optional, and if you want to do this, it will be just one-time activity which you have to undergo, and you can create multiple panels depending upon what are your molecule of interest. And the same function which I explained to you, that is MRM triggered product ion scan, we call it as MTS as well, that can be utilized in this particular method package as well. Hence, it will be able to give you a really good confidence on the data which is getting generated. At different collision energies, it will be able to generate the spectra. That spectra of product ions will be merged together to form a merged product ion spectra, which can be correlated or which can be matched with the already existing library for all the product ion spectras which are available for 2,500 plus compounds. And it will be able to be the structure as well. So this will give you high reliability or very high confidence on the data which will be getting generated using our system. In addition to MTS, that is MRM triggered product ion scan, this particular method package or the database has one more feature, which is again very unique, and it is an excellent tool to do unknown identification even at lower levels in any kind of matrix. We call it as MRM spectrum mode. Now, as I mentioned to you earlier, a traditional MRM will have a quantifier ion and a reference ion, and you need to have a very precise retention time to identify a particular molecule. Now, what if this particular molecule is at very low level and it is very difficult to identify it? So to enhance the capability of the system, or in fact, I can say other way, to utilize the best capability of system, we have incorporated this particular feature in this particular database, by which even at lower concentration, you will be able to identify a peak or a molecule or a compound without missing out. So what it basically does is, instead of utilizing single reference ion, with the help of the MRM spectrum mode, at different fixed collision energies, it will be able to generate multiple reference ions. So you can see here, in the traditional approach, there was only single reference ion, wherein case of the MRM spectrum mode, there is one Q ion and there are 13 reference ions which are being utilized. Hence, with the help of this, the peak intensity can be used to create a spectrum of fragment data, which is highly specific to the compound of interest and which is highly sensitive as well. So you can have, or you can improve the response of the molecule by having multiple MRMs which can be merged together. And the best feature of it is this multiple reference ions will be generated simultaneously. So you don't have to inject multiple times. With single injection in the same time frame, you'll be able to generate multiple MRM spectrums. Now, why is this very important is, as I mentioned to you, that even at very low concentration level, for example, here you can see the example of morphine. Now at 10 picogram concentration, we were able to identify this particular molecule as morphine. That hit as morphine was being identified. Now, with the 13 MRMs of morphine, which were being generated with the help of MRM spectrum mode, we had matched this particular spectrum with the library which is available as part of this database. And we were able to get the similarity index of 100, and we were being able to identify this molecule as morphine, even at 10 picogram level. In case if morphine would have been at even lesser concentration, consider at 100 femtogram, which is much less. It is 100 times less than 10 picogram. So even if this particular molecule would have been at 10 femtogram level as well, with the help of the MRN spectrum mode, we would have been able to easily identify it because we are generating 13 MRNs. And with the help of the library which is available, we'll be able to get the similarity index of 95 and confirm this molecule as morphine. The condition is that the analysis has to be performed under the same condition. So whatever conditions which we have provided to you as the part of this method package, it has to be utilized as it is. You cannot do any changes. The column chemistry, the system configuration, and whatever conditions which we have mentioned to you has to be replicated as it is. Because in an LCMS, to generate a particular spectrum, which is like a fingerprint, you have to have same condition to generate a particular spectrum. Same again and again. So under the fixed analytical condition, you will be able to generate the spectrum, and you will be able to get the hits in the spectral library, and you'll be able to identify the compound even at lower concentration level. Now, why do we need such kind of approach? Why we have to involve such kind of unique solutions or such kind of features in our method packages? The main reason is to reduce the false positive and false negatives in your report. Now, if you are screening a particular sample and you have been able to identify certain molecules, now those molecules which you have identified can be interfering with some of the other molecules, because first thing is they are in the matrix. For example, it's in the blood. So the matrix signal or the interference on the peak can be searched in library and can give you a wrong interpretation as well. Now, to avoid such kind of condition, or to avoid the understanding of the matrix peak as the compound, to avoid those conditions, we need to understand and we need to use the features like MTS or MRM spectrum mode, because we need to reduce the false positive rate of the reporting. Now, to get the greater confidence, it is required to first identify the compound. The more data and more spectral identification can provide higher confidence in identification, which is compared to MRM, which is already generated. Instead of that, you can use the feature of MRM spectrum mode, wherein you will be able to get multiple spectrums, which will be able to give you more better result even at lower concentration. You can identify that whether that particular compound which you're going to report is the one or it is falsely identified. Hence, with the help of the features like MRM spectrum mode or the MTS, you will be able to give an authentic result and you won't be able to report any false positives. At the same time, we also have to address the concerns of false negative reporting as well, because matrix effect can also influence a lot of false negative reporting. And obviously, there can be change in the retention time, or there can be change in the ion ratio as well. So spectral identification may add confidence in compound detection, and identification at a very lower detection level also can be done with the help of features like MRN spectrum mode. And with the help of MRN spectrum mode, you'll be able to eliminate the noise, because the RT or the ion ratio are not within the defined method tolerance. Hence, to avoid the false negatives as well, you can utilize the feature of MRN spectrum mode, wherein to be able to enhance the intensity of the or the target molecule which you want to identify, and will able to give you an excellent reporting or the excellent result as well. Now, when if we want to compare MTS versus MRM spectrum mode, then MTS is basically a survey scan of product ions. So it is a complete scanning which is being done for the product ions. No ions are missed out in that because you are going to fragment your particular molecule at three different collision energies, and it will be generating a spectrum. The ability to distinguish the isobaric species at its untargeted full scan, as it is untargeted full scan, you will be able to distinguish between the isobaric species as well. At the same time, it is an excellent toxicology screening tool which can be helpful when it comes to identification of the unknown toxic substances in the biological matrix. The MRM spectrum mode is basically it is able to generate the fragment, or it's basically the transition which is obtained at different collision energy. So it produces multiple reference answers. It has a higher sensitivity of MRN spectrum in the library for the identification by itself, because it has multiple spectrum ion as it increases the intensity of the molecule, and it is not triggered by a particular threshold. Like in case of MTS, there is a particular threshold. If the intensity reaches above that, then only it will undergo the fragmentation, further fragmentation. But in case of MRN spectrum mode, it is not bound to the intensity. Even at lower concentration level, you can use this feature to identify the substance. It is very less susceptible to noise interference as it generates multiple reference ions, and more number of reference ions which are generated will give you more confidence over the data which is there. Hence, even if there is any noise interference, it will be eliminated because of this particular feature, and has strength to identify the molecule even at very low concentration. So you can screen, identify, and authenticate the data which is getting generated using the forensic toxicology database which is available with Shimadzu. Hence, with the help of forensic toxicology database which is available with Shimadzu, and the spectral and MRM spectrum database which is available with us, and by utilizing the features of MRM triggered product ion scan and MRM spectrum mode, you will be able to get highest confidence in identifying the unknown molecules from the sample which you're going to utilize. Now, to address these features, it is very important for us to have a good MS. And you need to have high speed MS because we are going to work with large data. It's basically an information which is huge. So to utilize such information, you need to have something which is very fast. To address that, we have a solution, and basically we need to understand that why speed matters. And before we get into this particular topic, I will again get back to Mr. Satish, and I would like to ask him to take a poll opinion that what kind of technology is they are using, or it is used with by our customers who are listening this webinar, and would like Mr. Satish to take a poll on that as well.
Sure.
Over to you, Satish, sir.
Yeah. So the question to all of you here is, what is the technology preferred by you for identification and quantification in biological matrix? So the options are TLC, HPLC, or LCMS. So it could be either that you're already using them, or you prefer to use one of these techniques or any of these options. So yeah, so the answers are pouring in. So yes, so we have received close to around 60% answers. So we'll just wait for another 40% of them to give their replies. Yeah, another 5 seconds. Okay, so 5, 4, 3, 2, 1. Yeah, those results are, so 11% of them feel, are you able to see the results? Yeah.
Yeah.
So 11% of them feel TLC and 20% of them feel HPLC, but I mean, 69% of them feel LCMS would be the go-to technology for identification and quantification in biological matrix. So over to you.
Yeah, thank you very much. This is really very helpful. And now I can understand, like maximum people here, they feel that LCMS is a great tool to work with. And people who still have opinion of using TLC or HPLC, are certainly you have to change your mind and let you know that how an MS with good speed is going to help you in doing this work very easily and how you will be able to generate reliable results. So as I mentioned, that we need to have a high speed mass spec and why MS speed matters. So, and the important factor here is that Shimadzu provides you something we call it as ultra fast scanning, ultra fast sweeper, ultra fast switching. And altogether, we called our LCMS technology or the MS technology as UFMS. UFMS is nothing but ultra fast mass spectrometry. Now, what this has will explain you more in detail. Every MS does scanning of the ions which are getting ionized and entering into the quadrupole. Now, these ions, they form data points to form a particular peak. If these data points are not appropriate, or the number of data points which are getting generated are not enough, you will not get good reproducible results, especially when you're working with large number of molecules. You're working with 100, 200, 300, 500 sample analytes in a single run. And if you're not able to acquire it appropriately, and the peak which is getting formed doesn't have enough number of data points, your result will not be precise, it will not be accurate. Hence, you need to have scanning speed like 30,000 data per second, what Shimadzu provides. Now, with this high scan speed capability, which is provided by Shimadzu, you can maintain a high quality of spectrum at this particular speed. Now, what it happens here is, as more number of data are scanned or more number of ions are scanned, it will be able to form more number of data points. As you can see in the previous slide you saw, the number of data points were less. So the peak shape which is forming is very crooked. And this can be every time if this less number of data is formed, the shape will be crooked and your concentration or the area under the curve may differ. Hence, to have good reproducible result, you need to have more number of data points. Hence, you need to have scan speed like 30,000 view per second, which is provided by Shimadzu. Hence, we call it as ultra fast scanning. That is the capability of our system. Now, why that was very important? So we saw in early 2000s when the UHPLCs were introduced. At that time, the peak shape became narrower, the area under the curve was very narrow, the analysis time reduced. Now, the increasing speed of the HPLC demanded for the increasing speed of to increase the speed of MS as well, because if your peaks are very narrow, the peak shape is very narrow on the HPLC because of the lower particle size used on the UHPLC system. The diffusion of the peak is very less. Hence, more number of ions are formed and entering into your MS. Now, to keep up to the speed of HPLC, it was very important to have a fast MS as well, because we need to have good reproducible results. Now, here you can see there is a peak which has 20 data points, and the peak shape is excellent. Even at 10 data points, if you see, the peak shape is up to the mark. There is no problem. But the confidence which you'll have with a peak which is having 20 data points may not be as good as well, 10 may not able to give you that good confidence. And as the data point goes lower, the peak shape is distorted. It is absolutely hampered with lower number of data points. Hence, to cope up with the speed and to cope up and to have good reproducible data, it is very important to have a ultra fast scanning system. That is what is provided by Shimadzu. At the same time, you need to have a good quality of collision cell. So what Shimadzu provides is a very unique concept of USP per 2 in the collision cell. Now, what basically happens in this case is when your molecules enter into the first quadrupole, after the first quadrupole, it enters into the second quadrupole where your ions are getting fragmented. Now, those fragmented ions, they have to exit the collision cell without spending much time, because more time they spend, there are chances that they may slow down and may not exit the collision cell. Hence, in the USP per 2 technique or the technology which is available with Shimadzu, it exits the collision cell without staying in the collision cell, because there is a pseudo potential which has been applied, and it quickly helps in molecule after fragmentation to exit the collision cell. And if you see, in the conventional approach, the ions which are getting formed, they are getting hit on the surface. Hence, as they are getting hit on the surface, they become slower. As they become slower, they lose the energy. Hence, as they lose the energy, they don't have capability to exit the collision cell. In case of the USP per 2 technique, you can see the fragments which are formed, they're not hitting the surface that much. At 1, 2, and 3, they're exiting it. So there is absolutely no problem for any kind of crosstalk or any kind of concerns that a molecule may stay back and may affect the sensitivity of the analysis. Now, with the help of USP Sweeper 2 technology, it accelerates the product ion out of the collision cell faster, resulting in ultra fast data acquisition rate, dramatically minimizes the crosstalk. Now, crosstalk is something, it's a phenomenon basically, that once your fragments are formed, and if they are unable to exit, they stay back. And with the next ions getting entered, they may come out along with that. So it's more like carryover kind of thing may happen even in the collision cell. So that is drastically reduced when it comes to UFC per 2 technology. It shortens the MRM analysis time because it is very fast and it doesn't spend much time into the collision cell, and certainly it improves the sensitivity. And one of the most important and an excellent feature, and which is also very important, that is UF switching. Now, what we mean by UF switching is that when you are working with multiple analytes, where you don't know which molecule will get ionized in positive mode and which molecule may get ionized in negative mode, you need to have a system which can do this analysis simultaneously. That is, the positive ionization and the negative ionization of a molecule should happen simultaneously. That is one thing. At the same time, it is also very important, and it should happen at a very slow, at a very, very less time. It shouldn't take much time, because if it takes more time, there are chances that you may lose any particular ion and it may lead to drop in the sensitivity. Shimadzu provides you an ultra fast switching capability, which is 5 milliseconds. It is just 5 milliseconds and it is fastest. It is really very fast. So when you're working with the mixture of the compounds, wherein you don't know which can be positive and which can be negative, without losing the sensitivity, you can do this analysis in a single run. So here is an example which we have given. In positive mode, this was the intensity. In negative mode, this was the intensity. So these two analyses were done individually. When both these molecules were analyzed simultaneously, without losing the intensity or the sensitivity, it was able to reproduce the result as same as when they were run individually. So lesser the polarity switching time, better is the result. That is what we try to say here. And what we provide is, again, I would like to mention it's just 5 milliseconds. So you can imagine how accurate the results can be, even if you're working with multiple compounds which may have ionization capability in negative or positive. And as I mentioned, that when there are multiple compounds together, you're doing a mixture and you're doing MRM measurement. In that, polarity switching plays very, very important role. As you can see here in the first example, it was a time when there were no techniques available to do these positive and negative ions together. So even though if the analysis is of just 2 minutes, but as it will be the mixture of compound and you may not know that it has positive or it has negative, you'll have to do it twice to understand. So you will first do the analysis in positive mode, second you will do the analysis in negative mode. So even 2 minutes of analysis will take 4 minutes. Then comes the stage where the polarity switching was introduced, but it had inadequate polarity switching time. It was very, very high. The cycle time of switching was too much. That is, cycle time is basically from positive to negative and again negative to positive. So this cycle time was very high. And what used to happen is because of that switching time was high, the ions were getting lost, due to which the results were not reproducible and it was leading in loss of quantitative accuracy. But with ultra fast polarity switching, which is provided by Shimadzu, the cycle time is very, very less. As I told you, the polarity switching is of 5 milliseconds. So without any loss of ions, you'll be able to get good number of data points. Hence, the reproducibility of the result will be excellent and it will be able to maintain the quantitative accuracy as well. Hence, with the help of the solution provided by Shimadzu, you can have outstanding throughput with quantitative and qualitative accuracy. That is the capability of Shimadzu's UFMS technology. At the same time, to enable a feature like MRM spectrum mode, wherein you can identify a particular molecule even at very, very low concentration, you need to have a UFMS technology. Because here is just an example which we have demonstrated here, that is in method 1, where the compounds have only 2 MRMs. It will have total of 112 transitions in total. Now, in case of MRM spectrum mode, that is in the method 2, wherein each compound is having 7 MRMs, hence the number of transitions will increase. Now, if the number of transitions are increasing, it is very important for the system to scan it at very high speed, because if the speed of the system is not adequate, it will lose a lot of data and it will not able to generate the good reproducible result, and it may not be accurate as well. So to have the analytical accuracy and precision, it is very important to have UFMS technique. Especially, it should have an excellent scanning speed, which is again provided by Shimadzu, that is 30,000 U per second. So with the help of this, that is Shimadzu's UFMS technology, we can give a high-speed LCMS, which is very helpful for any kind of forensic applications and analysis. So with this, I would like to say thank you, and this is the solution which we wanted to demonstrate to the people in the fraternity. Thank you so much, and over to you, Satish sir now.
So we have got quite a few questions. So
Okay.
so once if you can stop sharing this, then we can start asking the questions.
Absolutely.
Yeah. So I would request even Karthikeyan to come on screen. Karthikeyan, if you're there.
Yeah, I'm here. Yes. Hello.
Yeah. Yeah, Karthikeyan. So we got quite a few questions. So I'll start with one. Do you have a database to screen forensic toxicology compounds? Is one of the questions from Bhuvana.
Okay, so yes, that is what we just demonstrated to you. So we have the forensic toxicology screening database for 2,500 compounds. Yes, and it has the library as well, spectral library, which will help you in identifying the compounds as well.
So there's another question again from Bhuvana. Do you have NMS2 technology for forensic compound screening?
Yes, so the one which I showed to you, the MTS, that is MRM threshold triggered product and scan, is where we are doing the synchronized survey scanning, where you can do the MSMS spectrum can be generated at 3 different collision energies. So yes, this can be done using it.
So this third question is about the best model. I would suggest like for this one for Karthikeyan, because MS can be a little intimidating sometimes. It sounds very complicated. So if
Absolutely.
I have to set up an MS lab, so what are the things that I need to consider before buying a mass spectrometer for forensic applications? Over to you, Karthikeyan.
Yeah. So the best model from Shimadzu is the 8045. So because of the 8545, the advantage what we will be getting the sensitivity, the 4 lakh is to 1. And another advantage in this instrument, the same 4 lakh is to 1, you'll be getting the negative ionization. Since we are doing a lot of unknown compound, we may not know that what kind of compound we'll be getting, positive or negative. So the instrument should capable enough to address both positive and the negative ionization compound. So the best model for this forensic toxicology is 8045. Yeah.
So apart from the mass spec, like what other things do we need to consider while setting up this lab?
Another one is a sample technology, because the basics is sample preparation only.
So a Quechas kit, and then
Yeah.
So when you are buying a mass spectrometer, so you the system comes with a method package, Quechas kit, and then the complete instrumentation. So these are the three things is what you are saying.
Yes, yes.
Okay. And there's another question from Mohammad Sharif for data interpretations. Do you have to follow any guidelines?
As such, there are no guidelines till now. It's completely dependent upon the data which is getting generated and the knowledge which we have. So to ease that particular part, we are providing the library, which will help in getting the better confidence.
And there's another question from an anonymous attendee. Since we are screening unknown compounds, will one common sample preparation help us to identify different groups of metabolites?
Well, here our targets are the toxic compounds, and yeah, certain metabolites, yes, it will be, because as I had mentioned, that we have optimized the particular quenchers, this particular technique, in specific to the forensic applications. So the sample technique, which will be provided as the part of the database or the method package, should be used as it is, and you'll be able to get the appropriate result easily. And to differentiate it, as I showed it in the forensic toxicology database, we have differentiated the LCMS method individually. That is, one is on the ODS column, one is on the biphenyl column, depending upon the chemistry. So there we have differentiated so that we can cover a large number of compounds without missing out on any one.
Yeah, there's another question which has actually come into the chat box. This is from Dr. Shetty Srinivas. So how can we decide drug to therapeutic dose and toxic dose? A simple question, but I have many doubts is what he's saying.
Sorry, I just
so he says, how can we decide a drug to a therapeutic dose and toxic dose?
That is absolutely on the basis of the tolerance of a person. So if it is in terms of medical, I don't think so. This is in terms of the forensic, because in forensics, there are thresholds which are already being defined by the government, that up to what level a person can administrate a particular drug. But if it is in case of any kind of therapeutic point of view, if you are asking, in that case, it's completely on the person's ability to absorb and metabolize the drug. On that basis, we can do. Hence, we always do therapeutic drug monitoring in that case to identify that what can be the level at which the molecule is more active for a particular individual.
Yeah, in fact, Dr. Shetty Srinivas is here. In fact, I have requested him to come online and then ask if he has got some more questions to be answered. Dr. Shetty, if you're
Yes,
there,
sir.
yeah, please go ahead.
Yes, sir. Good evening, sir.
Good evening, sir.
Yeah, good.
Yeah, my doubt is, sir, I'm a forensic postgraduate
Okay.
in Usmania General Hospital, Hyderabad.
Okay.
My only question is, thing is, epileptics and whatever psychiatric patients are, in many of them, they are consuming overdose. In that cases, how can we decide whether it is a overdose or a regular dose? That's my question. Why? Because they are taking on a prolonged period, no?
Yes.
Yeah, actually, in recent times, last 2 years in COVID, what happened? Many sudden deaths of epileptics and these psychiatric patients. It's a sudden death, but the drugs are coming positive. Diazepam also. I have seen diazepam and this heptoin.
Okay.
How can we decide whether it is a suicide or a whether it's
Drug
a toxic?
overdose.
Yeah, exactly.
Okay.
I am a Telugu fellow. I don't that much English, but okay.
Yeah, I guess we have to do very in-depth analysis for that because
my question, they are coming as a positive, heptine coming as a positive, these benzodiazepines are coming. My thought is whether because they are using prolonged period, no, whether it is coming positive or they are taken suicidally or what. And in this period, COVID, many of them died suddenly also because of COVID also, we don't know.
Correct. So
that's my question.
Yeah. So in that case, it's very important for us to understand what is the half-life of the drug. Correct.
That's what my question. Whether we can decide it, whether it is a suicidal or a regular dose. That's what my question.
That will be completely dependent upon the investigation. In the analysis, you'll be only able to get the concentration of a particular drug, or you'll be able to only identify a particular drug.
Yes. It's a pure investigation thing. I know that,
exactly.
But I want to ask whether we can come to know or not. I came across a case where diazepam was positive.
I see.
So basically, this becomes a tool where you can identify this. So the interpretation
that's what my question. I was very interested. I was
the interpretation is totally depends on you.
Some Satish was sent message me. I was very keen to attend this.
Yeah, this is me only. Yeah, Satish only.
Okay.
So the tool is basically for you to identify, and the interpretation is up to you, like how to interpret whether it's a suicidal
we don't
case
know.
or
We only send samples, so we don't know. But my question is to know what.
May I submit something? May I submit something?
Yeah. So, Dr. Bhatt, you also wanted to ask a question. Please go ahead.
Yeah. First of all, I should answer the query from a earlier speaker.
Yes.
Since I'm from forensic background, so I can suggest him this simply identification. By simply identifying, you cannot define whether it is suicidal or homicidal or by accident or something long exposure. Simply you can do it. If concentration is that high, suddenly it is high, then it may be positively by suicidal or homicidal aspect. Otherwise, routine taking drugs.
One more question also I have, sir. One more doubt also I have.
Okay, you just go ahead.
Shall I ask?
Please go ahead. Please go ahead. Yeah, this is an open forum.
Yes. In our this state, only alcohol percentage was 52 point something they are giving.
Okay.
How much it is related? Why? Because we may in news we see as this 300, 400, but in our reports, maximum is 52 something.
Actually, what happens? Actually, I got it your point. Actually, what happens after consuming alcohol, person may vomit, person may move here and there for a while, person may do some exercise or urination and all that.
Yes, sir. That is the maximum value we are getting. That's only not more than 52. That's my doubt is why there is
that may be due to the technical flaws. I don't know.
That's what. This is related to this. No, this our colleagues know right now.
Actually, what happens? The scientist is always limited to whatever is provided to him on. Okay, if sample is like that, then he cannot support the cause. frankly.
No, sir. My question is, they are giving maximum as only 52.
I don't know why, what condition they are receiving the sample in. So that may be the reason.
No, sir. We didn't see till now more than 52. Is there any thing that more than 52 is in your this thing, lab thing?
See, the quantity may vary according to the consumption. So you cannot
Yes,
differentiate.
it's not like that.
Comes
Sir,
52.
it's not like that. They are giving only maximum 52.
I don't know. There are parameter. Maybe their parameter also that
that's
they
what.
cannot go beyond that.
That's what.
So,
maybe that's what I'm asking.
Yeah. So, Dr. Shetty, I think
Dr.
probably we can
Satish.
take your question offline and then answer. So, some more
No
question.
problem, sir.
Yeah.
No problem.
Yes, sir. Dr. Bhatt,
Healthy.
please go.
Thank you for the opportunity to interact with you.
The whole talk was only on MS. Okay.
Correct.
Yes.
LC part is very little you were discussing. Number one.
Okay.
Number two, whether this equipment is hyphen technique so that we can switch the MS to GC also. Whether this is possible with Shimadzu. Suppose we have GC of Shimadzu and LC of Shimadzu. So whether we can switch the MS to GC, number one. Number two question. I'm asking all the three questions so that you can answer one by one.
Sure,
okay.
Please go ahead.
Number two, your database has got some validation from any agency or something. Number 2 point, because legally we have to validate our database. Yes. Number 3, whether your MS will do or MS is required for that. Because Dr. Ann has to be produced in the forensic science, it is very much required for Dr. Ann interpretation. So yes. This is these three questions I am interested in.
Sure. So I will try to answer one by one. Sorry. So with respect to your first question, can we switch from GCMS can be clubbed with the LC part or not? So no, sir. Both are MS, but they work on two different principle by itself. So that part is absolutely not possible, because in case of an LCMS, the liquid part which is going to enter into the MS has to get ionized in the ion source itself. And we need to get rid of all the liquid part, because your mass spec is in a vacuum. And even a drop of water or any liquid enters into the vacuum, it will create liters of gases. So first thing is we need to get rid of that. In case of GCMS, it's completely different. The sample which is getting analyzed is in
that I know, that is two different things. But I am asking, there is a switchover mechanism is there or not? Because in MS we have the direct probe system. We can directly enter the substance into the mass. So that is altogether a different issue. But I am simply asking whether there is a concept of switching the GCMS or MS.
Yes. No, that is not possible. That is absolutely not possible. Now, I'll come to the second question which you asked, that are these library which has been generated, the compound authentication and the whatever database which has been created is authenticated or not? So this particular database is being generated with the help of Japanese police department and the forensic team there. So it has been authenticated by them and it has been developed by them in their lab itself. So that gives us a good confidence when it comes to the database which has been generated.
Okay.
Yeah. And the third question which you asked about
Dr. Ann.
Yeah. So the one which I mentioned to the product Ann spectra. So in Shimadzu, we call Dr. Ann as product Ann. So it is basically an MS technique which we are using, and not only MS. So in Shimadzu, we call Dr. Anns as the product Ann. So those product Anns are basically what we are focusing on and trying to generate the data which may become more reliable to identify a particular compound.
Okay, thank you so much.
Thank you so much, sir, for the questions.
So we have a few more questions. So one question is, my question is signal to noise ratio. So which is the best method to analyze the signal to noise ratio? That is the question.
Best method?
Yeah. For the background, for the sample background, what is the best method to measure the signal to noise? So probably wants to know how do you measure the noise?
Okay, maybe Karthik, can you take up this question?
Yeah. Actually, that the signal to noise ratio, there are many algorithms to identify. There are protocol like ASTM and some other algorithms also available. It depends how many compounds we are doing. So based on that, and what regulations you are following, based on that, you can apply the particular algorithm so that you can get the signal to noise ratio. So this is how we can do, because in pharma, if you use, they'll be using USP, or they'll be using for a Japanese pharmacopoeia, or sometimes they'll go for ASTMs also. It depends. So which regulations they are following, which regulations demand for the particular algorithm. Based on that, they can use it. Yeah.
Yeah. So probably in case of forensic, a standard one can be ASTM, which can be utilized.
So there's a question from Lakshmi Priya. So how will you deal with designer drugs?
As in, see, basically what we need to understand is what is the molecular weight. So for absolutely new drug, which may not be part of this particular method or database, you can try to generate the spectral data and you can make it part of this particular database which you are going to provide for you. So it is completely flexible and you can try to generate the data and you can try to incorporate. So for absolute new compound, which is recently developed or it is in process of development, that has to be done manually and try to identify.
So there's another question from Mohan. How reliable is this method with respect to visceral samples? Have you done any work with visceral samples?
Visceral samples. Okay, visceral samples.
Sorry.
Visceral samples. Yeah, so in that case, basically the visceral samples can be tissue or any kind of skin sample or something that way. Yes, so this particular database, we have a technology which is a little bit different, wherein you can directly put in the tissue extract and try to identify these toxic substances. And yes, it can be done with the help of visceral samples as well. But only we will have to do some extractions, which can be a little bit different, and we can certainly try to identify the toxic substance from the visceral samples as well. Yes.
So there's another question from anonymous. Is UHPLC required as a front end or any analytical HPLC is good enough?
UHPLC is most preferred. And when it comes to the method packages and databases, we have developed it with a UHPLC system. And as I mentioned to you, that we are going to provide a library. And to generate the spectra, we need to have same analytical conditions to generate it. So yes, you'll have to use the UHPLC system to get the appropriate results as the front end.
So there's another question from Elisa. I would like to have more explanations on Quetcher's method when analyzing antibiotics from wastewater. I'm not sure whether,
sure thing. Probably this is like, we'll have to discuss more in detail because we'll have to explain it in detail and how it can be further utilized. So probably we can take up this question one-to-one.
Okay. So Lakshmi Priya says, if developed in collaboration with, I think this refers to your previous answer.
Yes,
if developed in collaboration with Japan Police, so how relevant is it to the Indian scenario?
Well, the drugs are going to remain same. The molecules are not going to change the structure. They're not going to change their property. So it's basically the authentication which is being done for the molecules. So it is even in an Indian scenario or any global scenario, it is going to remain same. And these solutions are not specific to Japan or not specific to India. They are utilized globally by different forensic agencies across the world. Hence, this gives us very good confidence for us to promote it in global market as well as in Indian market. Yes.
So there's another question from Madan Mohan. Do you have a facility for analysis of polar pesticides in rice matrix? Probably this is a wrong platform. Maybe you can take that.
Yeah. Probably, yes, we can try to take it up later and we can try to check with our food expert who is part of our organization and get back.
So we like to have more explanation on Fetcher's method when analyzing antibiotics. So again, antibiotics into wastewater.
Yeah. Probably our environmental specialist and food specialist will address this particular concern.
So there's one question from Anonymous. So what will be the financial implications of having a LCMS system? Karthika, if you want to take this.
Yes.
Can you come again? Yeah.
So wants to know what is the financial implications of, what would be the cost of setting up a lab, kind of a question.
Yeah, it depends upon the model, what they are looking for. As I said, that the 8045, so 8045, there are other models also available, 8050 and 8060 NX. So it depends upon the application, what they are looking for. And if they want to add some other compound, based on the scope, we can decide which model can be suitable. And in general, forensic toxicology, 8045 is more than sufficient, but still we need to get more information about the background of application. Based on that, we can promote our model.
Yeah, so it's basically like a application based this thing.
Yeah.
So it's not just buying an instrument or buying a box. It's a complete solution that is required. So I think a better one-to-one discussion to understand your requirement and then give a tailor-made solutions to your requirement would be more suitable than just giving you a certain figure. So this is what we would suggest. I think we have answered all the questions as of now. I'll just see if there's anything missing out. Yeah, I think we have answered all the questions as of now. Is MRM spectral mode a part of the software function, or do you have to perform manually? So this is one last question.
It is part of the software. So it's basically a single click procedure and an instrument does it by itself.
Okay. Yeah, so this is the end of the question answers. So we have one video which we like to play, which gives you the methods and the how is exactly the analysis done. So I'll just play this one video.
As forensic toxicology demands increase, testing laboratories need a database that offers accurate and comprehensive analysis of target compounds. Shimadzu's Forensic Toxicology database for LCMS-MS delivers faster data acquisition, higher data quality, and enhanced identification for all your analysis needs. This expansive database features optimized LCMS-MS data acquisition parameters and a mass spectral library. When used in combination with a Shimadzu LCMS-MS instrument, it provides a total solution for toxicological analysis. With over 2,100 compounds, this extensive MRM and spectral library database enables rapid screening for compound identification and confirmation. Shimadzu's Lab Solutions Insight software offers easy viewing of the compounds of interest, including structural information, retention time, and library similarity score. Shimadzu's Forensic Toxicology database is equipped to meet your unique application needs. It is built for two separation conditions, C18 and biphenyl. The C18 method delivers information on 1,250 compounds, and the biphenyl method provides information for 1,281 compounds. Together, these two methods contain all the compounds available for forensic toxicology analysis, including illicit drugs, psychotropics, medical drugs, hypnotics, pesticides, and natural toxins. Search against thousands of forensic and toxicology-related compounds for targeted compound screening and quantitation. Shimadzu's Lab Solutions Insight software uses 3 MS-MS spectra with 3 different collision energies to increase specificity and reporting confidence. The synchronized survey scan feature allows you to automatically trigger 3 different MS-MS scans for high-quality spectral matching. Lab Solutions Insight also enables you to produce high-quality results without the need to define a threshold value to trigger an alert, decreasing the chance of false negative and false positive reporting. This feature, which is called MRM Spectrum Mode, acquires all compound fragments of interest in MRM mode and can be used to create accurate spectra from even trace concentrations. With Shimadzu's Forensic Toxicology database, developing analytical methods is quick and easy. You can selectively build methods to streamline the analysis of hundreds of compounds in a single analytical run. The database contains not only optimized MRM transitions, but also multi-targeted screening, MTS, and a range of other data analysis conditions. To accelerate customized method development, the compound list creation tool can be used to select specific panels of target from the library for analysis by LC-MS-MS. Rather than looking through thousands of analytes, you only focus on your compounds of interest. Shimadzu's Forensic Toxicology database for LC-MS-MS offers an expansive library to help you get the quality results you need fast. To learn more about the Forensic Toxicology database or to request a demo, visit www.ssi.shimadzu.com.
Sir, please unmute.
Yeah, thank you so much for attending our webinar. We look forward to your participation in our future webinars as well. With this, we'd like to thank Bhaumik Trivedi and Kartikeya, and thank you all the participants, and have a wonderful evening. Thank you.